Exercise makes us happy, healthy and smart. And there's pretty good evidence to show that exercise makes us happy and healthy, and emerging evidence that it changes in a very positive way the way our brain functions. And this is important for people across the board. For almost every person, they have these positive health benefits from exercise, and that includes people with disabilities. Yet fewer and fewer Australians are exercising. Children in particular are more sedentary now than they ever were at any point in history. The results of this are pretty frightening. 1 in 5 preschool Australian children are overweight or obese. 1 in 4 school-age children are overweight or obese. And by the time we get to adulthood, 2 in every 3 of us are overweight or obese. And obesity isn't just a problem in the general population, it's an even bigger problem among people with disability, because they are even less active and engage in exercise less often than their typically developing peers. And obesity is just one issue and one physical manifestation of the fact that we are moving less. I haven't mentioned type 2 diabetes, osteoporosis, heart disease. And there's also lots of social negative consequences for not engaging in physical activity and exercise, and these include social isolation and a lack of community engagement. People with disabilities have even more reason to engage in exercise and physical activity because we know, compared to their typically developing peers, that they have poorer health, are more likely to be obese, and are more likely to have chronic health conditions. So why is it, when we have something that we know makes us happy, healthy and smart, that fewer and fewer Australians are engaging in exercise? Well, the truth is, the partial truth is that exercise is hard. You have to get hot and sweaty. It takes effort. It takes motivation. It takes time. Sometimes it costs money. And these are just some of the few barriers that all of us experience when we go to engage in exercise. Now, if you have a disability, the barriers towards engaging in exercise are even more enormous because of the fact that you have a disability. So as part of our research, we asked people with disability what made it hard for them to exercise. And they told us many things, but 2 things stood out for us. One was that they reported a lack of suitable programs to engage in exercise. And the other thing they said is that they had a lack of somebody to exercise with. So it made us start thinking, well, if they had a suitable program and if they had somebody to exercise with, would they engage in exercise more often? I want you to hold that thought for a minute. Now, I'm a physiotherapist, and as you can tell from what I've already said, I'm interested in exercise, I'm interested in disability, and I'm interested in young people. And a number of years ago, I was asked to take on the undergraduate coordination of the paediatrics program in physiotherapy. And one of the first pieces of feedback that the students gave me was that they wanted more experience working with young people. At the time, there were very few paediatric clinical placements available to our students. And paediatric clinical placements are one of the few places in our curriculum where students get exposed to working with people with disability. It's worthwhile thinking for a minute about the type of training that our health professionals get during their clinical training. Most of their training happens in tertiary hospitals. These are acute hospitals where people are very sick and out of their usual environment. So when you think about it, most of our students get exposed to people with disability in places where they're at their sickest and they're not in their usual environment. And this lack of exposure to people with disability is something that physiotherapy employers have themselves identified in a recent report. Now, why would this be a problem? Well, the experience that students get while they're at university is actually a very powerful thing in their lives. And there is evidence to suggest that the student experience is a much more powerful indicator and influencer on future careers than either the university coursework they do or job availability. So that's the second thing I want you to think about or hold on to for a minute, is this idea that the student experience is actually really, really important. Now, the third little piece of this puzzle is the idea that people assume, incorrectly I might add, that physiotherapy students' attitudes towards people with disability are very positive. In fact, when we look at the literature and we compare their attitudes to those of other students from other allied health disciplines, they are in fact not as positive. And so one of the things that we wondered about was, well, why might that be? And we thought it might be because they have a lack of exposure to people with disability during their training. Now, negative attitudes to people with disability is quite topical at the moment because the Australian government have just legislated for the National Disability Insurance Scheme, going to be called Disability Care Australia. And we have had some commentary in the media, from CEOs of major Australian companies about how society really think about people with disability. And I think it's fair to say that even though we have moved on, Australian society still has a pretty negative attitude towards people with disability, and we still tend to view disability as a tragedy. Now think about the negative consequences of having health professionals with negative attitudes towards people with disability. And there's really two things to think about there. One is the fact that if you are a health professional and you have negative attitude towards people with disability, then you're probably less likely to work in the disability sector. So there's a workforce issue there. People might be less likely to work in disability. The second thing is with regards to the quality of healthcare that people with disability get. There is evidence to show that people with disability don't get the same quality of treatment that people without disabilities get. And that could perhaps be as a result of a negative attitude for the health professional who's providing that treatment. So, on the one hand, we have a group of young people who need to engage in exercise, but who need somebody to help them exercise with. On the other hand, I have a group of young people who need exposure to people with disability and who could benefit professionally from that exposure. So my big fat idea was to put those two people together. And the program that we came up with is called FitSkills. Now FitSkills is a partnership. It's a partnership between the university, between community disability organisations, and also with community-based sports and recreation facilities and providers, such as the YMCA. There's a couple of really key features about the program. First thing is that it is evidence-based. This is a program that we have grown from our research and we have built up and developed over a number of years. The second thing is that it's a one-to-one program. So we have a young person with a disability, we match them with a physiotherapy student from the same locality, and so that pair go to their local gym and they exercise together. Now there's a really important element in that exercising together. It's that the student is not there as a fitness trainer. They are there as an equal, and they also have to exercise as well. So part of the thing when we match people is we think about it very carefully, and we try and make it as socially meaningful a relationship as it could possibly be. The second thing, or the other thing about the exercise program that we do is that we have them exercising according to international best practice standards. So they're not just going down there to do a couple of chest presses and a couple of leg presses and a couple of lat pull downs. They are there to work hard. It is a high intensity program, and we train them in exactly the same way that we would train any athlete. So the question probably now in your mind is, well, does it work? And the short answer is yes. For the young people with disability, we've got evidence that they respond to the training in exactly the same way as you or I would respond. That's the formal part. Informally, the feedback from the young people with disability and their families has been that this has been a life-changing experience. For some of them, it's the first time that they have done something independent of their families in a community setting with somebody else. For our students, we have got really clear evidence that it changes their attitudes towards people with disability. They are more positive, more comfortable interacting with people with disability as a result of the experiences they have. They get it in a way that they didn't get it before. They also develop their professional skills, and that includes their general professional skills, things like communication, organisation, problem solving, and also more specifically in physiotherapy in relation to exercise prescription. So what are we doing now? Well, Most of this work has grown from our research. And so the next step is to translate our research into ongoing practice. And that's the point at which we're at the moment. So we are seeking funding to establish this as an ongoing program. So if there's anybody out there who's got a nice bucket of money and who would like to come and fund us, we'd be more than delighted to talk to you. The second thing we're doing is we're continuing to work with the university and collaborate with the university structures to make sure that this is an ongoing educational experience for the students, that we embed this type of community engagement, service learning experience in our curriculum. And this meets very nicely, or works very nicely, with the university's new strategic plan, Future Ready. We are continuing to collaborate with our community partners. They are a really key element in the work that we do. And so we continue to work with disability organisations such as Down Syndrome Victoria, and also with the recreational and sports sectors such as our partners Disability Sport and Recreation and the YMCA. Finally, what we are doing is we are continuing our research. This has been the basis of what we've done, and it's a really important integral part in what we continue to do. We need to continue to have evidence for what it is we do. And that will mean that we create this ongoing structure and ongoing program that is of benefit to both people with disability and our students. So I'd like to leave you today with just a couple of photographs from the students and the young people with disability who have been involved in the program. And this one's my favourite. I think this photo really encapsulates what this program is about. So this is Sinead and one of our students, Sarah. And to me, this really gets across what it is that this program really gets to the core of.